Hello and welcome everyone joining us from around the world. My name is Niall Kavanagh and I am the Communications Officer here at the Global Brain Health Institute, and we are so happy to have such a diverse group with us today, with participants joining us from nearly 70 countries around the world. And I just wanted to note that this is the second part of our two-part webinar series. If you missed the first session where we introduced the Atlantic Fellows for Equity in Brain Health program, you can find the link that will be shared in the chat. And I also wanted to note that today's session is being recorded and will be available to watch later. In today's webinar, we are aiming to do a few things. So after this session, our audience, during this session, we will share information about the application process for the Atlantic Fellows for Equity in Brain Health program. We're also going to share with you a number of tips to make your application strong. And we will also explain how we select fellows and what we're looking for in our candidates. And we'll have an opportunity to answer your questions and help clear up any confusion about the application process. I will note that as we are going through the presentation, you're very welcome to ask questions using the Q&A button at the bottom of your screen. And today we're very fortunate to be joined by two of my illustrious teammates from the Global Brain Health Institute. In just a few minutes, we'll hear from Anne-Marie Glynn, who is the Chief Operations Officer of GBHI at Trinity College in Dublin. And she'll be guiding us through the application and selection processes in more detail. But first, I'd like to introduce Professor Leah Grinberg. Leah is a professor of neurology and pathology at the University of California, San Francisco, and a faculty member at GBHI, and she is also a member of the executive committee at GBHI. And Leah is going to start by giving us an introduction to the application process. She will review candidate expectations and explore a little bit about the impact that we hope our fellows will have after the program. So Leah, I'm going to hand it over to you, please.
Hello, it's really a pleasure to be here and see so many names and faces in my screen. I know you cannot see, but I can see you all. Pleasure to be here. As Niall introduced me, my name is Leah. I'm a neuropathologist by training, originally from Brazil, and now working in the US with a lot of global health initiatives on my portfolio. And I have been involved with GBHI from the very beginning, and especially coordinating the selection process. So it will be my goal today to share with you a little bit what we envision for the fellowship, what we are looking for, and of course, later on, answer any questions you may have. I will share slides right now. I hope you can see my slides. I believe you can. So let's make an introduction to the application process. And this will be the 9th time around we are doing that. All right, next. So what is GBHI? I believe that most of you are familiar with GBHI, or you've met someone from GBHI, someone who came through our program, or maybe some of your friends or your mentors. But in a nutshell, GBHI wants to reduce the scale and impact of dementia around the world, and we feel that we can do it in 3 ways. So the first way, which I think is very important, is collaboration. Collaboration between people of different disciplines, of different places, that they can exchange ideas and exchange strategies and brainstorms of how we can achieve our goal. And we like to do it, especially expanding in preventions and in interventions. And prevention is very important for many of the countries and people we are serving, because, as you might know, interventions are still in baby steps. We are starting to have it right now, especially pharmacological interventions. And we know from many studies that prevention can really make a difference in dementia, maybe preventing about 1/3 to 50% of the cases. Of course, when we are together, we share knowledge, we exchange ways we deal with it in different places, and we think it's very important to engage in advocacy. So I'm a medical doctor and I went to regular medical training, and I didn't learn at medical school how do I deal with trying to convince the stakeholders, the government, people who are making decisions in a higher scale, why to implement whatever of the proposals we are doing for dementia. And GBHI, it's very strong into this, and we teach fellows how to do it, and we encourage our community to do this kind of advocacy. And of course, all this to train the next generation of leaders in brain health through our Atlantic Fellows for Equity in Brain Health program, which is part of GBHI, and I will talk a little bit about it right now. Again, GBHI, it's all about to break barriers and to promote equity. We do it engaging across disciplines as opposed to other programs in this field and in other fields. Part of our fellows, they are in the biomedical field, medical doctors, psychiatrists, nurses, but many of our fellows, they are artists, they are filmmakers, or they make dance interventions, or they are lawyers. They try to work with advocacy and change the rules on how things work. They are educators and they are community leaders. So by doing this, we break down these traditional barriers in which these different professionals don't meet each other. And by doing this, we can really commit and to resolve these issues around inequity in brain health. Inequity in brain health means different things in different places. In some countries, people with dementia are still considered to be part of witchcraft, and they are banned for the villages. In other places that have maybe a more Western side civilizations, we still have a lot of inequalities. No access to brain health or to hospitals or even to preventions to this barrier. So the important point of GBHI is that we don't have a formula that fits all. Each person who comes will come with a set of problems, and together as a group, we'll try to create solutions for this. For GBHI, and we have a very important and strong leadership program here. We believe that leaders, they have a set of values that we really reinforce here. A leader has to be authentic, has to be fair, has to be open to hear and to listen, to have respect at all levels, of course, courage to move forward, and energy, and certainly empathy to deal with all this burden burden we are trying to solve. And this is these values at GBHI is something that we developed a lot during this year of fellowship, and I think is a strength of the program. So what is the fellowship? It's a 12 months paid fellowship, either at Trinity College in Dublin or at UCSF in San Francisco. During this fellowship, there is a core curriculum covering key areas like neurology, health policy, data analysis, the clinics. It covers more or less, I would say, 30% of the time here. Each fellow receives one-to-one mentoring on brain health projects that are brought by the fellows. So it's not a top-down approach, it's the opposite. We have participation in clinical cases for practical insights, and of course, the opportunity to network, to connect with world-class researchers, not only during the fellowship and around the place where the fellowship is taking, but through our many connections and conferences and activities. Also, at the end of the fellowship, fellows have the opportunity to apply for funds to pilot projects in their place of origin. And this is done in partnership with the Alzheimer's Association and the UK Alzheimer's Society. Of course, there is our leadership program. Our leadership program has a 1-week leadership kind of conference in which fellows get together. Last year we went to Ghana, before we went to Ireland. We went to different places. It's really a bonding week with a lot of leadership skills developed. And we have leadership pods across the year. So again, leadership development, it's very strong component of our program. And we can take leadership at different levels. So again, it's not one formula fits all. We really work with individual fellows to see where they are and where they need to be. At the end of the program, everybody has a certificate in equity in brain health that certainly help with promotion and the next steps and the engagement with the global community of Atlantic Fellows. Again, it will be our 10th class, and we have over 230 people who graduate for our program, and they are very connected. We have also a very strong department of alumni in which we promote activities, and there are opportunities to meet. And we really believe in this global community to combat inequality in brain health. So where our fellows come from? They come from many places. In our first 5 years, we have an emphasis on the Latin American and Caribbean and the Mediterranean area, which gradually shifted in the past years more to the African continent. But if you look at the map, you see that our fellows come from different places. So if you have a good idea working in this area, don't be shy to apply because you might not be in one of our areas with a higher number of fellows. We are interested in the individual, in the potential, and this is what is important for us. What we want is to train the next generation of leaders that will benefit from the program by pivoting their career to the next level. And I think with this, I will hand over to my colleague Anne-Marie Glynn, who will talk about application and selection processes.
Thank you very much, Leah, for that comprehensive overview. And as Leah noted, next we are very pleased to introduce Anne-Marie Glynn, who is the Chief Operations Officer at GBHI at our Trinity College Dublin site. And Anne-Marie is going to take us through step by step the application process, including some of the required documents, deadlines, and technical guidance to help you navigate your application. So Anne-Marie, the floor is yours.
Thank you very much, Leah, for that lovely introduction, and Niall too. So just to go into some of the details of the application for those of you who are interested in applying, I'll walk through the process and then some of the things that you may want to consider as you select. So the basics, first of all. So in order to participate in this program, you would need to be available to complete 12 months in residence. So this means either relocating to San Francisco if you're at the UCSF site, or to Dublin, Ireland if you're based at Trinity. The program is held primarily through English, so proficiency in the English language is important, and also having the ability to travel internationally as required. So the image that you can see here was some of the fellows who were in Ghana last year at the leadership retreat. So it's not only necessarily based in Ireland and in California, the education. Another thing that's very important, so the Atlantic Fellows are global, and it's expected that you're going to have most of your influence in your home regions. So after the 12-month fellowship, it's crucial that you have regional support and mentorship in the communities where you're hoping to make an impact. And in the application form, you'll see you'll be asked some questions about regional mentors, so kind of like who you can imagine they would be and how they may help you to be transformative in your home country. And when it comes to referees, you may choose to ask those same people to write a letter of support for you, or you may not, but I'll come to that in a bit later. So regarding education and training, I had a sneak peek at some of the questions, and I can see there have been some work in this area. So we have a diverse range of fellows, and depending on your background and what is usual in your field, it's expected you would have the highest degree, and this differs. So for example, for an artist or other creative professionals, you would require a public platform, your portfolio, things like this, not necessarily an undergraduate degree, although many have. With physicians, it would be expected that in addition to having your MD degree, that you would have completed your other residency and specialities. And for researchers, it would be usual that they have a PhD and postdoctoral training. And if you're an innovator, you have a track record of achievement in your field. And across all of these fields, it's very important that you have a mission, that you want to advance the field of brain health and dementia prevention in whichever way suits you. So when it comes to the dates, these are listed in Dublin, Ireland time. So the final application deadline is 20th September, 5 p.m. If you are successful in being invited to interview, you'll be advised of that in November and be invited to interview. And then the application outcome, so whether you are being invited to join the program or not, will be communicated in January. And then the current application round is for fellows who will join us in end of August 2025. Okay, so in more or less a year from now. So what do you need for your application? So there's an online application system. I'm going to show you some pieces of that in a moment. You will also need to have your resume or curriculum vitae updated, have a statement of purpose. I'm going to spend a bit of time talking about this, and letters of support. And the first thing you need to do to view these is to look at our website. So this is gbhi.org/apply. And you can see here, if you go to that page, in addition to seeing some of my wonderful colleagues from the conference in Cape Town earlier this year in the image, there's this yellow button where it is apply to fellowship. And if you click there, it will open up a page as follows. So basically, the first thing you're going to see is a general page asking you to confirm that you've read the instructions, the advice, and understood this. And that's going to restate some of the things I've already mentioned, like with letters of support, resume, etc. You will notice that you have the option in the top of the page to save your progress and come back to it later. So you can do this piece by piece. And if anything, we would recommend that the large bodies of text, you write them in a separate Word file, for example, and then cut and paste it into the form. When you are completing the online application, you're going to be invited to select which is your preferred GBHI host institution. And in addition to updating and uploading your resume or CV, you're going to have to detail things like your education, your training background, your fields of occupation. You're also going to have the opportunity to add supplemental information should you choose. So for example, if you have a portfolio of work or a video or something else you want to add that you think would strengthen your application, that will be possible. The statement of purpose is critical, and that's the reason I'm going to focus on this in a bit more depth. So in that, you're going to be asked to describe your professional interests in the area of brain health. So this should include things like, what's your motivation for working in this area, and what are your goals for the future? In addition, we'd also like you to reflect on your experience to date. You know, how have you shown leadership working on issues related to brain health equity? And if you can do that through a specific example, that's all the better. And then the other thing is, it was mentioned that you'd be joining a community of Atlantic Fellows across the world. So basically explain to us, you know, what excites you about joining a lifelong fellowship and the GBHI community, and how could you see yourself contributing to that community if you were to become an Atlantic Fellow for Equity in Brain Health. Another thing you'll be asked to do, and this may link to the pilot award, if you continue with the same idea after joining the fellowship, but it's to describe an ambitious yet a feasible project that you'd like to lead. And kind of the timeline for this is considered within 5 years after the completion of the fellowship. And finally, if you can also identify who are the relevant individuals or which are the relevant organizations or institutions in your home region that can help you succeed and to implement your work and, you know, to go forward. So if you have already engaged with them, you can outline this in your application. These are quite succinct answers, so only 75 to 150 words for each of these. Regarding the letters of support, 2 letters of support are required. It's slightly different if you're applying through the French Fondation Alzheimer. It's recommended when you're considering who to write your letters of support that one of them needs to be from your current employer or your institution or your organization or a group that you've recently engaged with. We advise that you reach out early to the person or people you're going to ask for the letters of support. And regarding the sequencing of this, to be aware, so basically you as the applicant should submit your application before the deadline to give time for the writers of your support letters to upload their letters. So basically their letters of support also need to be submitted before this deadline of September 20th, to be aware of this. So how does this work? So if you, as the applicant, you would write to your or contact the people who will write the letters of support and clarify with them which is their preferred email, so that and whether they can complete it before the deadline on your behalf. And then once you have submitted your application, a link will be sent to the people who are writing your letters of support directly. And with this link, they will go in and upload their letter of support. So we recommend that you may want to check in with them to make sure that everything goes in before the final deadline. So the application, is considered incomplete unless all required materials are submitted by the deadline, including the letters of support. And to note that you may submit just 1 application per cycle, so per year. And it's recommended that you would do this at a desktop or laptop rather than using a mobile phone. And also that if you have an outdated version of the iOS or Android operating systems, you may experience some issues. So maybe go in and check that, first of all, that it's compatible with your device. As I mentioned earlier, there is a Save Your Progress button at the top that you can resume later. So then once you put in an email and a password, you will be able to then return to the same application again with your answers to date saved. You may wish to consider writing your statements of purpose in a separate document and then transferring them across. So this helps you with things like clarity of what you're writing, but also ensuring it's within the word limits, etc. As a reminder, the application needs to be sent in English. And if you are a French citizen, you will see that there are additional questions that you will be invited to answer should you choose to wish to be considered for the French Fondation Alzheimer Fellowship. So regarding the selection criteria and the process, just to kind of summarize, you have a personal mission that's aligned with the goals of the Global Brain Health Institute and have already demonstrated a commitment to brain health. Atlantic Fellows tend to be visionary with ambitious ideas and a feasible plan to put those ideas into action. Something about timing is important as well. So basically that you're poised, you're at the right inflection in your career to have an impact in the community and to have a potential to have transformative leadership. Another thing that's noted among community is there's a spirit of collaboration and an interest in being part of a global fellowship, and that you've thought through where you want to be in the next 5 years or so and how this fellowship could help you achieve those goals. And to remind you regarding the dates, so September 20th is the application deadline. Notifications for those invited to interview will be in November. And then after the interviews have been concluded, in January, people will be advised if they need to just submit official transcripts for further evaluation to be formally offered the fellowship. Thank you very much.
Thank you very much, Leah, or Anne-Marie, rather. Just a moment. Thank you very much, Anne-Marie, for that detailed explanation of the application process. So before we move on to the Q&A component of today's session, we just wanted to take a moment to review some of the key points that have been introduced in this session so far that will help you craft a strong application. As Anne-Marie had just noted, we recommend that you start early and request your letters of support well in advance to ensure that your application is submitted on time and eligible for review. We encourage you to detail your purpose and clearly outline your professional interests and leadership in brain health equity. And also a reminder to showcase your project. So in your application, we encourage you to propose a feasible, impactful project with regional support to help support your application. And also, we encourage you to demonstrate your long-term dedication to ensure that they are in alignment with our program's values and goals. And also, please do highlight your experience and include a detailed education and professional background so we can get to know you better. And as I expect, we'll get to a little bit more in the Q&A section, but please do carefully consider your host institution selection. There are very specific opportunities at UCSF and Trinity that might align better with your training and career goals, so please do choose thoughtfully. So with that, I would like to invite our panelists, Anne-Marie and Leah, to return and join us for the Q&A section. And Leah, if I could invite you to turn your camera on as well, please. And we covered a lot of ground so far, but surely there are many questions coming in, and I think some of these will be very helpful to get your insights on. So perhaps we can start with a few questions about competitiveness and selection criteria. And Anne-Marie and Leah, if it's okay with you, I'll pose a question, and if you feel comfortable taking it on, feel free to do so. I think we'll all benefit from your expertise, from your shared expertise. All right, so question one, how many fellows are selected, and on average, how many applications do you receive?
Sure, I can answer this one. The number of applications have been growing each year. Last year, we have around 250 applications. The number of fellows we received this each year combined on each site are about 28 to 30, sometimes 31. So every year is different, but what we are seeing is an increase in the number of applications every year by about 10 to 15%.
Okay, thank you. And is there a limit to the number of fellows that GBHI accepts from a particular community or geographic area?
We try to balance our cohorts to encompass different areas and different specialties. This is part of the consideration, but saying that, we don't have a strict limit in the number of fellows we receive per region. So that we had years in which we had maybe 5 fellows from the same country because their portfolios and proposals were very strong.
Thank you. And how about this one? Can you apply for the fellowship if you are not currently a resident in your home country?
You can, if you can demonstrate that you are planning to work in projects that will promote equity in brain health. So let's say you are from a given country and you are working in another country, but in this space. It's not a problem. What is very important for us is to understand what we will be doing after the fellowship, what are the plans, and if you have support to do it. So if the support is in a different country and you continue there, but applying, a project in this field, it's fine with us.
Wonderful. Thank you for the clarification. And here's another one. Can the 12-month Atlantic Fellowship be taken alongside another fellowship or another commitment, such as the Fulbright Fellowship? So question around time commitment and if it can be balanced with other commitments.
You want to answer this,
Yeah.
Anne-Marie?
Yeah, I can go with that. So basically, the commitment for the Atlantic Fellowship year, it's a full-time commitment. So it would not be possible to combine with another fellowship in that sense. However, during the fellowship year, you will have time, in addition to the didactics and the things that were outlined earlier, for your own self-directed learning and projects. But it would not be usual to hold 2 fellowships concurrently. Yeah. Would work.
Okay. Thank you, Anne-Marie. And here's one that I think would be good for clarification. Is there a space for professionals interested in brain conditions different from dementia? We are the Global Brain Health Institute. We've talked a little bit about dementia, but what about space or potential for professionals interested in brain conditions different from dementia?
Right, so the simple answer for this is yes. But the more complex answer for this is that you need to consider that as a program, we are very committed to create a network, a community of people that they are working together for, promoting equity in brain health. We are better equipped to do it, especially in the area of aging and dementia. It doesn't have to be dementia due to Alzheimer's disease. It can be to HIV. In certain areas, stroke is very important. But, if someone has been working in promoting equity in brain health for pediatric conditions, probably this application might be less competitive because we might be less equipped to support these fellows. So when we compare portfolios and ideas, etc., in a very competitive environment, we might be better equipped to support projects that are in the area of aging in general.
Okay. Okay, here's another one for you, Anne-Marie and Leah. Could you speak a little bit more about GBHI wanting applicants who are doing preventative work versus work that is dealing with current diagnoses?
We are open to anything in this field. It can be prevention, primary prevention, secondary prevention. It can be dealing with caregivers or people that already have dementia at different stages of the disease. This is less relevant for us. What is more relevant, again, is that the project has to be in this space of promoting equity, and there is a feasible plan. And the plan, it's also visionary in this sense, right? We are more interested in projects and in people that can make a difference at a large scale, that can make a difference in their, in a small place, or that whatever they will do might be amazing, but just affect 10 people.
Yeah. And to add on to what Leah has said, for those of you who aren't sure, does this fit me? Maybe if you look at our website, I mean, there are beautiful bios of the fellows, and they are tagged with the countries they're from, but also the areas of interest that they have. So you will kind of begin to get a sense of the flavor of the diversity of the community, which encompasses everything that's been mentioned just there.
And speaking of the diversity of the community and recognizing that we have people coming from lots of different backgrounds, we do have a question from an independent artist who is not working with a particular institution or community group, but rather with several project-based efforts. And this person is wondering, in that kind of instance, and perhaps if there are examples from current community members that would help illustrate this point, but this person is wondering who is best to ask for letters of recommendation, perhaps if you're not formally attached to an institution or community. Does anything come to mind for either of you?
You want to take it, Anne-Marie?
You want to go ahead?
All right. Yeah. So, yes, especially for artists, we are not necessarily expecting that someone will be affiliated to one institution. We had several past successful fellows that were working more as freelancers, or they have several projects at the same time. Again, the most important is to demonstrate already some commitment to this area of mental health and promoting equity, and what will be a project that this candidate would like to develop if the person comes to the project. So, in a nutshell, why do you want to come to this fellowship? Why it will make a difference in your life, and what will make a difference to have you to make a difference in other people's life, especially regarding promoting equity in mental health.
And then a related follow-up question, Leah or Anne-Marie, and Leah, you just talked a little bit about it, but I wonder if anything else comes to mind. But one of our audience is asking what information is typically included in a letter of support. Anything that you haven't touched on yet that would be typically included in the letter of support?
Yeah, let's take 2 or 3 minutes to talk about it, because we understand that letter of supports mean different things in different countries. So when we talk about letter of support, we are thinking on a letter of support like it's used in the US and in Ireland. So letter of support states the character of the candidate, why the candidate is a good candidate for this particular program, why this candidate can go the extra mile to really make a difference. And very important, we know from past experiences that the most successful fellows are those that have regional support to implement their pilot program when they come back. So for instance, you have 2 letters of support. We allow maximum 2. So ideally, especially for people who are in the research career and some career, maybe government, stuff like this, it's important that one letter of support will be from a superior saying, we are very pleased that this person is applying for GBHI. We think it will be transformative because of, it's our goal to improve, in this area or to expand. And when this individual will come back, we will guarantee secure time for this individual to implement this program and maybe give some resources. It doesn't have to be money, but it has to be protected time. It has to be availability to access certain populations. This is very important. So this one letter of support, I strongly recommend you find someone, again, who is your boss or your superior, that will demonstrate support towards you. And the second one can be, a colleague you are working with or a past mentor that really can vouch for your character, why you are best suited to be in this very competitive program. A letter of support that says, I confirm that this individual is working in this place is not a strong letter of support. We get it every year. We are not trying to verify your employment. We are trying to learn about you.
Yes, very important. And thank you for the additional explanation. Leah, I know it is an area that's asked about a lot, so appreciate the thorough explanation and additional ideas. How about what happens after the fellowship ends after 1 year? What happens next typically for fellows? Does anything come to mind?
70% of our fellows, they go back to their original places with a pilot grant, again, sponsored by the Alzheimer's Association and Alzheimer's Society in the UK, to implement their pilot. So this is very important. And we have a very strong activity in the alumni space. So we have meetings by Zoom. We have groups that are, they like to work in the same kind of space. Usually all the fellows, they are invited by the Atlantic Institute to go to Oxford the year after they finish the program for a convention, also with the other Atlantic Fellows program. Usually the mentor, who is the mentor during the year, continue to accompany the fellow. So our goal is that we accompany the fellows for life, and we help these fellows to go to the next step to establish themselves. It can be to write grants, including for agencies in the US and Europe that sponsor projects outside. It could be for other foundations. It could be by being a stakeholder in a field or in a conference. So actually, I would say that the life really starts after the program, because this is really when you have the opportunity to implement your ideas, to pivot, to really expand, and you'll be walking this walk with you.
Mentioned, I think, a key idea, Leah, that's asked about by another audience member that relates to mentorship. And so one of our audience is wondering, curious to know more about the mentoring aspects of the fellowship and how it has helped fellows with their long-term career. So I wonder if you can talk a little bit about mentorship.
Absolutely. Mentorship is very important. GBHI is very fortunate to have a great number of very accomplished mentors in the program. So when we finish selection, there is a group that deals with selecting mentors, and they carefully examine the CV of the candidate and the letter of intent, and try to match this prospective fellow with a mentor that will help this person to grow. So what is to grow? It depends. Some people need help to learn how to write a grant or a paper. Some people are very good on this, but they need help on data analysis, or they are already very accomplished in what they need to do, but they would like to expand on how do I do advocacy? How do I talk to the government to try to expand my programs? So we will try to match this person, the candidate, with a mentor that will fulfill this role. Now, another beauty of GBHI is that we encourage everybody to connect with other faculty. So you might have a main mentor that will help you to navigate in the program or next career steps, but also to connect with other people, other stakeholders, other accomplished researchers and professors to help you in your journey to reach what you need to reach.
And before we close, we are coming up on our time here, so perhaps we'll have space for one more question to close with. And then I would encourage our audience, if your question wasn't answered in today's session, please do refer to the GBHI website. There's a lot of great information on there. And you can also feel free to reach out to our team at apply@gbhi.org. If you have specific questions that were not addressed today. But before we do close, I think an important question that's come up from a few of the members of our audience, wondering what factors influence if the participants choose either UCSF or Trinity. What considerations are important to make when choosing the host institution?
Anne-Marie, would you like to start with this?
Sure, I can start. So I think the main thing is you're reviewing the website and considering the faculty who are working either in Trinity or GCSF at the Global Brain Health Institute, how you could work with them as a mentor to better achieve your goals. So there's a different strengths of the two institutions, and depending on what you see your future vision as and how you can grow more, that might help you determine where your first preference would be. The great thing about this is you become part of one community, irrespective of the site you're part of. So you have access to fellows from both sides, and and much of the classroom training is joint. So there's advantages, but I think it will be depending on your vision, your goals, where you can have maximal impact. And if you're not sure from looking at the website, you're also welcome to reach out to people there to kind of work out the chemistry as well, if you could work together.
Yes, it's very important. And, also in the website, you can find information from our former fellows. So you can identify people who come from the same region or who come from the same specialty, and reach out to them. Their websites or their emails are there, and ask about their experiences.
Okay. Well, with that, I wanted to thank you, Leah and Anne-Marie, for sharing your wonderful expertise. We are at our time, so we are going to move to close now. And I also wanted to thank our audience for the wonderful questions and engagement. As we wrap up, I do want to encourage all of you to apply, or if you have friends or members of your network that you think would be a good fit for GBHI and you're not sure, as Leah had noted earlier, we do encourage you to apply and to connect with us. We are looking for individuals who are poised to make an impact, and we're excited to meet you. Know that this fellowship is a wonderful and unique opportunity to grow as a leader in brain health and to make a lasting impact on a global scale. So for more information on the application process, as noted earlier, please do visit our website. The link is in the chat, and also feel free to reach out directly to us at the email that's shared in the chat. And as a reminder, you will also receive a follow-up email with a link to this recording and additional resources. So with that, I wanted to thank you all for joining us, and we look forward to reviewing your applications. Thank you, and take care.
Thank you.